Welcome, everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. It's important to remember that public health measures continue to be the most important protection to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, use respiratory etiquette by coughing into a tissue or your sleeve,
and wear a mask when attending commercial establishments. I will now report our current case counts. There are 117,792 cases of COVID-19 in Canada and 39,628 cases in Ontario. Chatham-Kent has 288 cases and Sarnia-Lambton has reported 319 cases. Michigan now has 84,050 cases with 12,818 cases being in Detroit. Today, we are reporting 2,351 cases of COVID-19 in our community, an increase of 1 case from yesterday in the agri-farm sector. 1,955 cases have now resolved, 298 people are self-isolating, and 7 people are in hospital. 27% of our cases are between the ages of 20 and 29 years, and 24% are between the ages of 30 and 39, and 17% are between the ages of 40 and 49 years. 65% are male and 35% are female, with 1% unknown at this time. Our community has lost 71 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. There is 1 long-term care and retirement home in COVID outbreak. In addition, there are 14 workplace outbreaks. 6 are in the agriculture sector and 7 are in the manufacturing sector, and 1 is in a construction workplace. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain if you are feeling confused or losing consciousness. Please be reminded that Windsor-Essex has 2 COVID assessment and testing centers, Erie Shores Healthcare in Leamington, Windsor Regional Hospital Aulette Campus. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. To check your results, please go to wechu.org and click on View Your Results to access the online test result portal. If you are unable to view your results, please contact the assessment center or healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us again. At each stage of the pandemic and throughout the entire pandemic, Windsor-Essex County Public Health Unit has been committed to providing evidence and science-based information to the public, various agencies, community partners, and businesses on COVID-19. The response to different stages of pandemic varied. In the beginning, there is a little known about COVID, and the rampant misinformation led us to focus on providing the credible, accurate information on our website. As a result, we redesigned our entire website, populating it with relevant, timely, and factual information for residents and of Windsor-Essex to easily find the information they need and to address their questions. Once we passed that stage and learned more about COVID and its impact in the community, we started developing guidance documents and educational tools for individuals who were at a higher risk of contracting and spreading COVID. For example, shelters, group homes, food services, and other essential services at the beginning of the pandemic. As more workplaces and businesses began to open their doors, we launched the Safe Return to Business, a public health toolkit for Windsor-Essex business community. This toolkit launch was accompanied by a webinar with myself and our senior team, hosted by the Windsor-Essex Chamber of Commerce, to walk through the tools and answer the many questions that employees and employers had, including dispelling the myths and clarifying the facts around COVID-19. This work has not stopped. Our team has continued to meet virtually and reviewed many reopening plans, provided tailored advice and support to many of these businesses. These conversations have led to the development of workplace-specific checklists for reopening that can be found by going to our website at www.wechu.org/CV/workplace-specific. All checklists are posted in French and English and currently includes checklists for personal service settings, libraries, emergency food distribution, fitness studios and gyms, office settings, outdoor sports and recreation, and many more toolkits that businesses can use in our region. As we continue to work through this pandemic, as the next stage, we're now talking about the school reopening. We know that the announcement for the reopening of school is both a relief to parents and youth, as well as a concern. The Windsor-Essex County Health Unit works closely with all of our school boards in this community to ensure the health and well-being of our children and youth. Our team has been meeting with and discussing COVID-19 with our school board partners throughout the pandemic and is currently working on guidance that is specific to the school setting, including educational materials, age-appropriate signage, and other tools and resources that will support teachers, parents, children, and youth to ensure a safe return to learning. Reopening any institution, workplace, or public setting comes with risk during the pandemic. As I've mentioned before, when we bring more people together, the potential for transmission increases. This is why ensuring public health guidance and measures are not only in place, but strictly adhered to is critical in any reopening. The Windsor-Essex County Health Unit will continue to work closely with our school boards over the coming week to assist in their preparation and will continue to provide ongoing support and guidance throughout the school year through trained and experienced public health unit staff. Thank you.
The conference is now unmuted.
We'll now take questions from the media. Any questions from CBC?
Yes, good morning, Dr. Ahmed. Today, only one new case. That's the lowest daily case count since the beginning of this pandemic. What do those numbers tell you?
Well, we are seeing a shift in the number of cases recently, which is definitely an encouraging sign. And I would just like to still urge caution to continue to follow the same measures to keep these numbers at that level. And I think based on some of the messaging that we have done in the last couple of weeks, our community, I want to give credit to them that maybe we're doing better than we have before. And we were able to bring those case counts to a level or to numbers that are much more reasonable given our size of the community. So I would like to see that trend continue. And I want to thank everyone for following all those measures that we've been asking them to follow.
And there has been a bit of a delay when it comes to provincial testing on area farms. Do you think the lower numbers that we're seeing in the agri-farm sector are because the lack of testing?
Well, I think there are a number of testing initiatives that's been happening already, and even the number that we are reporting, it is from the farm. So there are testing happening, and some of those measures are already in place. I wouldn't say that it's not happening. I think it just needed more coordination and more support, and now we have a good system, good partnership in place, and that testing is ongoing, and we'll hope to ensure that we not only test these people, but we support these farms to stay safe and to prevent any introduction of new cases in their farms.
Thank you, Dr. Ahmed.
Any questions from Blackburn?
I guess just making sure, outside of the agri-farm sector, we're still getting tests back. This isn't just an anomaly because we're not seeing test results. Everything's kind of normal in that sense.
Well, that's what we're saying, that when we are testing people and if we are getting fewer positive, that's definitely a good sign. But knowing that this work is ongoing and we are testing more farms and looking forward to it, hoping that the numbers will stay reasonable without causing any concern and alarm in the community or even in the farms themselves.
And I don't know if there's any validity to this. We got an email from to our general email account. Was there some kind of legal challenge regarding your mandatory mask order, and have you had to make any changes to that?
Well, there are, I guess, we receive questions, complaints, concerns all the time, and we look at that. And there is always, every time I'm issuing a Section 22 order, anyone can appeal that order under the law, and the appeal board look into the rationale, the recommendations, and the reasonability of the order, and then make appropriate recommendations. So this is a normal process that happens all the time. Every time I'm issuing an order, so that process is still happening and happens all the time.
But have you had to make any changes to it because of one of those processes?
As we like to work with all our partners, because we definitely want voluntary compliance. So if there is any language, if there's anything in the order that is that helps someone to make it easier for understanding or easier for implementation with achieving the same objective, I'm always open to it. And some of these discussions and conversation always happens. And right now, I think we get these comments, these questions, these complaints. We'll look at it, and if it's feasible, we do that. Right now, about the mandatory face mask, we haven't made any changes, but if there's anything that we can help to clarify or enhance to ensure the safety and well-being is not compromised, I'm all ears. I'm happy to listen to it.
Thank you.
Any questions from AM 800?
Dr. Ahmed, for the resolved cases, just looking at the numbers today compared to yesterday, about 500 difference that are resolved. Can you talk about that process, how an individual becomes a resolved case?
So the typical definition that we use for resolved cases is 14 days from the onset of symptoms or 14 days from the time of testing, depending on if the person was symptomatic at the time of testing or not. So that's the timeline that we use. And within that 14 days, let's say if an individual continues to show symptoms, then they can go past 14 days. In most of the instances, 14 days is the typical timeline that everyone gets resolved. There could be some delay in connecting with the individual to ensure that they are symptom-free, and then that chart is appropriately reflected back in the electronic system that the ministry use. So sometimes there could be a delay, and that shows some difference in terms of how many actual cases are resolved versus how many are currently active. So we look at that number. We are looking at it carefully to give us a much more accurate estimation all the time. There are electronic medical record system that we use. That the ministry has a different system, and then some of the operational challenges. So, not trying to make it more complicated, but just the different reporting mechanism, it prevents us from using just only one source, and in the interest of being more transparent and share the information in a timely manner, we continue to look for creative ways to provide you with the most up-to-date information. The numbers that you are seeing today is a result of that cleanup and ensuring that we have the most up-to-date information that we can provide to the community.
In Windsor-Essex, do we still have any cases, for example, if an individual was confirmed case, let's say in April or May, and there's symptom, or it was a very severe case, is there still anyone in our region that was a confirmed case early in the process that is still dealing with the virus?
No.
Thank you.
Any questions from Windsor Star?
Yes, good morning, Doctor. Is the sector-specific return-to-work business checklists, are those new?
Some of them are new as we continue to receive all those requests. So we look at it, and in response to that, we tend to create a more generic guidance tool that can be used by the entire industry. So for example, if one gym is approaching us and asking for some guidance, we not only provide them individual guidance, but we also then create a checklist that can be used by others too. And some of the new ones are the sports and recreational facility. So that's the new document, and we continue to populate more and more document as we receive more requests and identify the need for those guidance documents for our community. We are here to support everyone, and any of the businesses, any specific industry, if they have any questions, they need more guidance from us, I would encourage them to connect with us, and we'll try our best to work with them.
And you also said you're working on guidance with the school boards for safe return to school. What are some of the biggest changes that you're recommending that they implement for classroom settings?
Well, there are a range of approaches that we are trying to recommend, just going through even some of the basics of what kind of engineering control they need, what kind of administrative control they need, what are some of the challenges with the transportation, how we can support them with the school busing, how we can cohort all these children, how these children will go out and play in the field and whatnot. So there are a number of issues that we are covering, and it should be the guidance document will be going out, I think, either today or as soon as we can, and that would provide them with a good overview of what the public health recommendations means and how they can operationalize it, because the key part still is a lot of that is guidance. We are not the school, we are not operating the school. So based on our guidance, it would provide them with a good understanding of operationalizing the entire guidance document for each and every school. Maybe it could be, there may be some differences. The principals may look at that guidance document and create a custom plan for their school, and that's how it will work.
Is that guidance document going to be available on the Health Unit's website?
Yes, it will be available on the Health Unit website.
Okay, and just to be clear, you said it may go out today. Is it going out today, or is it going to come out sometime later in the week?
I believe that we
Sent it to the school board.
it's already sent to the school board. We'll make sure that it's available on our website as well today.
Okay, thank you very much.
Any questions from CTV?
Good morning. A new study suggests Canadians will face a potentially explosive increase in mental illness for years following the pandemic. What are your concerns in regards to long-term mental health impacts COVID-19 will have on Windsor-Essex?
Well, I guess we know the challenges of how many challenges that COVID has brought to us, both economically, mentally, and physically. The people who are impacted by it, the people who got hospitalized, received intensive care, people who lost their lives. So that's one side of it. But the mental well-being and the depression, the anxieties, the addictions, all those issues will continue to stay with us for a long period of time as well. So definitely this is a concern, and any kind of major event, this is what we see as an impact. So I think it is critical for the agencies and for the experts in those areas to take good action in those areas for improving the overall mental well-being of everyone in the community and also in the province. So public health will be working with our partners too, as part of not only WeCost, the Windsor-Essex Community Opioids and Substance Strategy, but also with our Canadian Mental Health Association partners and other partners, Hotel du Grace Healthcare, to provide that level of support that we need for the mental well-being of our community. This is an important thing. And again, different stages of pandemic bring different challenges for us. So this is, as we continue to move forward, it is in our radar, and we are already talking about it, that how we can support that. So those initiatives we'll likely see in the next few weeks, or in a maximum in a month's time.
Is there a demographic that's on your radar?
Well, the demographic data, again, we don't necessarily have that level of detail, because right now, again, the focus is on COVID. But what we can say is definitely the mental health and well-being is affected. Like, everyone is affected by it at certain levels. Some are affected more than the others. People who have a predisposing condition or likelihood of developing mental health issues, anxiety, people who are suffering from anxiety, depression, they're obviously at a higher risk. But what we are seeing right now in this pandemic, anyone can be at risk. So I think from a public health side and using the more upstream approach, we will be focusing on the entire community rather than just a specific population. But anyone with mental health issues, pre-existing mental health issues, obviously that would be the focus for some of the agencies that are providing direct client care, and they will continue to work with it, and public health will provide our support and guidance to address the issue at a population level.
Thank you.
Any questions from Windsorite?
Good morning, Dr. Ahmed. Last week you had mentioned that the health unit would be working with the low German-speaking population in Essex County after a surge of cases to provide them with tools and information, access to testing, access to care, etc. How's that worked out in the past week or so? Have we seen a decline in the number of cases that are coming from that population?
Yeah, definitely. We've seen a decline in the number of positive cases. We did see a large number of people going to the assessment center. So when people are going to the assessment center, and if they're coming back as negative, that's definitely a good sign. But it also opens up more opportunity for education, especially from a prevention perspective. So we will continue to work with that population. We'll continue to extend our support, all the tools, personal protective equipment, guidance for churches, and guidance for these type of gatherings based on their culture and traditional practices. We are here to support everyone in our community, and we'll continue to work with them along with many of our public health colleagues across the southwestern region to provide that support, recognizing that this population tends to go beyond the traditional borders of the health unit jurisdiction. So a coordinated approach across the region is essential, and we are working on it, and we'll continue to work on it.
Okay, thank you.
Any further questions from CBC?
No, thank you.
Blackburn?
No, thanks.
Any further questions from AM 800?
Dr. Ahmed, the town of Essex yesterday at their council meeting approved sending off another letter to the health unit seeking more information. I know we asked you this last week because they sent you a first letter, and then Kingsville sent you a letter. Just wondering your response about receiving another letter from the town of Essex.
Well, my response has always been the same. Let's not make it a political issue. It's and keep the community together and work towards it. The numbers and data is available, what we can share on our website, and even on the request of getting down into the details of the based on the dissemination area map, we showed that map too, and we'll continue to provide whatever data we can provide given our limited resources that we have and make it available to the public. So I think it's just I feel that we're talking about it, but we're not looking for the data. The data is there, and we just need to make sure that we are looking at it, and we will be bringing all those letters to our board for their consideration and recommendations, and that's how we will deal with it. But right now, the data that we can share, it's available on our website, and we will continue to look for additional data that we can share without compromising the privacy and confidentiality of any individual, but also not stigmatizing any specific community, any specific neighborhood, and we'll care for everyone. We are not looking for just for some I'll just stop there.
Is it getting frustrating, but to receive these letters? From day one, you and Teresa have said how much the team is doing, the resources, maybe even the lack of resources. Is it getting frustrating receiving these letters?
Well, I think it's just it's going back to the same question, which we have always said, that let's not make it a political issue. It's an issue that's impacting us. It's impacting everyone in the region and in the community. We have been more than transparent than many other health units. We have been providing all this data and information much more than anyone else. Obviously, there's always someone that you can compare and find that they are providing this. But if you're looking at it, they are also not providing some of the additional details that we are providing. Both Teresa and myself, we are sitting in front of you every day since the beginning of this pandemic to offer our insights, offer our expertise right from, and you can hear it directly from us. The data, the numbers, we have been reporting it daily right from the beginning of this pandemic. No one did that. Maybe now others have started doing that, but we were the first one to start doing that. We started sharing all that information based on whatever requests we were getting, and we'll continue to do that. And just like the addition of the new maps that we have created and showed, we have the team of epidemiologists, 2 epidemiologists, and also we're recruiting for 1 more epidemiologist. The amount of data, the amount of cases, it's not just for public consumption that we are showing and putting on our website. These EPIs are also busy in helping us manage these outbreaks. The number of cases that we are seeing in this type of, in this region is by rate, we are the highest in the province. So the amount of work that our EPIs are doing, the amount of work our team is doing to provide you with the most up-to-date statistics, I think it should be commendable rather than being questioned or being said that we are not getting this data, we are not getting this data. And just like I said it before, we are talking to each of the municipality CAOs, the board chairs, the mayors. We have this conversation regularly, every week or every other week. What I can say is none of these issues are brought forward in those meetings. And if those issues are that relevant, then have a conversation, reach out to us. What specific data are you looking for? And then maybe we can have a conversation of whether we can provide that data or not. But just putting it out and making it a political statement, I'm not a politician, and I won't respond to this type of political statements. The only thing that I care about my community. If there's anything based on my professional expertise that can be beneficial for the community to understand without putting anyone at risk, I will do it. If there's any specific need, a specific question, please reach out to me and I'll see if we can provide that information. That's all I can say.
Thank you, Dr. Ahmed.
Any further questions from Windsor Star?
Just curious, will the school board recommendations be accompanied by a news release, or will those be posted on your website more softly today?
It will be more softly. We'll just post it on our website.
Okay. Do you have any idea what time that might be made available?
It'll be this week, not today.
We'll try.
Okay. So we'll try to get it today, but definitely this week, and maybe we'll ask to see if our team can maybe just send a quick note to anyone who's on the call today, just as an FYI that we have posted this.
Great. We're just wondering what to look out for and when. So I appreciate it.
We'll have Mike send out an email to everyone.
Thank you so much.
Any further questions from CTV?
No, thank you.
Windsor 8?
Right.
No, thank you.
Okay, thank you, everyone.